Hello guys, so now we shall be discussing the anatomy of the oculomotor nerve. Oculomotor nerve, right? So the first cranial nerve is optic, next the first cranial nerve is olfactory, next is optic, third is oculomotor nerve, which is your cranial nerve number 3, okay, cranial nerve number 3. So this is your oculomotor nerve. Now when it comes to the oculomotor nerve, this is a section of your midbrain. Okay, what is this section? This is a section of your midbrain. Now in this section of the midbrain, a few important things you can see. First of all, let me write down these few important things. What are these few important things are? See, these two elevations which you can see, these two bumpy elevations, let me use another color. Right, so these two bumpy elevations which you can see on either side, these two bumpy elevations are nothing but called as your superior colliculus. Superior colliculus, okay, superior colliculus. Second important thing is that in the center, can you see this part? What is this called as? This is called as cerebral aqueduct. Okay, what is the center opening there? See, this is a center opening like this. This particular center opening is called as cerebral aqueduct. Cerebral aqueduct or aqueduct of Sylvius. Now, surrounding the cerebral aqueduct, whatever grey matter you see, this is called as periaqueductal grey matter. So, this is called as periaqueductal grey matter. So, this is called as periaqueductal grey matter. Now, surrounding this periaqueductal grey matter, there are 4 nuclei or 2 groups of nuclei you can say. What are these 2 groups of nuclei? See, this particular nucleus which you can see over here, this is called as oculomotor nucleus. Oculomotor nucleus. Okay. And next, this particular nucleus which you can see over here, this nucleus is called as Edinger Westphal nucleus, from where the parasympathetic fibers will start. So, this is called as Edinger Westphal nucleus, from where the parasympathetic fibers will start. And down here you have got this red color nucleus which is called as red nucleus or nucleus ruber. Red nucleus. After the red nucleus, this one is called as your substantia nigra. You have got the dopaminergic neurons over here. Substantia nigra. All of you know that if this dopaminergic neurons are damaged, this would end up in having Parkinsonism, right? So this is your substantia nigra. Next, down here you can, near the peduncles, you see this is called as one peduncle, this is called as another peduncles, right? So near these structures you can see 2 important arteries. So this particular artery which you can see over here is called as posterior cerebral artery. This is called as posterior cerebral artery. Next, this particular artery over here is called as superior cerebellar artery. Superior cerebellar artery. Superior cerebellar artery. Now, one is posterior cerebral artery, another one is your superior cerebellar artery. Now, this posterior cerebral artery and superior cerebral artery are coming from where? Are coming from this particular structure over here. This is called as your basilar artery. Basilar artery. Okay. Next, this box which you can see over here is nothing but called as your cavernous sinus. Okay. And this is your eyeball for sure. Now, within this eyeball, you have got extraocular muscles. So, what are the different kind of extraocular muscles which you can see? See, the first important extraocular muscle over here is this one. This is called as superior rectus muscle. This is called as your superior rectus muscle. After superior rectus, this muscle over here is called as your inferior rectus. Superior rectus, and this is called as your inferior rectus. Next important thing is that this particular muscle over here which you can see is called as levator palpebra superioris. So which is present on the upper eyelid, which is responsible to raise the eyelid, to open the eyes. Okay. So this is your levator palpebrae superioris. Next, down here this muscle which you can see, this is called as inferior oblique muscle. Inferior oblique muscle. So this is your inferior oblique muscle. And you see this muscle in the center, this one, right? I am writing it as A, and A here stands for medial rectus. This is called as your medial rectus muscle. Next, now let us discuss about the branches over here. So the first important thing you need to know is that the nucleus which you can see over here, as I already told you, that is your oculomotor nucleus. And next nucleus over here is Edinger Westphal nucleus. First we'll talk about the oculomotor nucleus. Now from this oculomotor nucleus you see this a nerve that is coming out, blue color one. This nerve is nothing but called as your oculomotor nerve or cranial nerve number 3. Okay. This oculomotor nerve initially it passes over, how is it passing? Look, this oculomotor nerve is passing over, right? It is passing over the red nucleus, and then it is passing through the medial half of your substantia nigra. If I divide the substantia nigra into two parts, this is called as the medial half, this is called as the lateral half. So this nerve is passing along the medial half of substantia nigra. Then it is passing in between two arteries. One is called as a superior cerebellar artery, another one is called as a posterior cerebral artery. You see, it is passing between the two arteries, coming down all the way, and it is passing along the lateral wall of cavernous sinus. So what wall is this? You see, what is this wall? See this particular, let me shade it down. You see this particular shading, whatever I am doing, right? So this wall over here is called as your lateral wall. This is called as lateral wall. So this particular nerve passes over the lateral wall of cavernous sinus, and then it is entering through this opening. What is this opening called as? This opening is called as supraorbital foramen or supraorbital fissure. Supraorbital fissure. So fissure is different from foramen, don't confuse that. So this is supraorbital fissure. So oculomotor nerve, once again I am telling you, oculomotor nerve started from the oculomotor nucleus in the midbrain. It is passing over the red nucleus, then the medial half of this one, the medial half of the substantia nigra, then it passes in between the superior cerebellar artery and the posterior cerebral artery. Then it comes down all the way and it passes along the lateral wall of the cavernous sinus, and then it passes through the supraorbital fissure, and within the supraorbital, after coming out of the supraorbital fissure, it will divide into two branches. Okay, so one is called as superior division, another one is called as inferior division. See, this division over here is called as superior division, and this particular division is called as inferior division. So what is this superior division doing? This superior division is supplying two muscles. What are the two muscles? Levator palpebrae superioris and superior rectus. And inferior division is supplying three muscles. So it is innervating three muscles. One is your inferior oblique, inferior rectus and medial rectus muscle, right? So even if you remember, you have to remember the formula, guys. So this formula, LR6 SO4 R3, just remember this, most of the muscles will be covered. What do you mean by LR6? The lateral rectus is supplied by the sixth pair of cranial nerve. The superior oblique is supplied by the fourth pair of cranial nerve, and the rest remaining muscles are supplied by the third pair of cranial nerve. So lateral rectus and superior oblique, leaving that, the remaining rectus muscles, right, all of them are supplied by your this third pair of cranial nerve. And also one more thing is that this nucleus is called as Edinger Westphal nucleus. From the Edinger Westphal nucleus, what fibers will come out? I told you there are parasympathetic fibers. Parasympathetic fibers will come out, right? So these parasympathetic fibers, they pass along what? They pass along this red nucleus. They are passing they are passing almost parallel to what? Parallel to this nerve, that is oculomotor nerve. So they pass parallel to this oculomotor nerve, they also pass in between your posterior cerebral artery and superior cerebellar artery, and they come down, they also pass along the lateral wall of the cavernous sinus, and they are entering into your orbit, but they are not dividing into superior or inferior division. Rather, what is happening? What is happening is that they are following along your nerve to inferior oblique. You see, they are passing along with the nerve to inferior oblique, and here, see here, they are passing along with the nerve here, oculomotor nerve. Then next they are through the supraorbital fissure, they are entering into the orbit, and directly they are passing along what? Tell me. So first, can I tell that they are passing along with the inferior division, not the superior division? Within the inferior division, this center nerve is called as the nerve to inferior oblique. So these parasympathetic fibers are also passing along with the nerve to inferior oblique, right? Then they directly enter into your ganglion. So this particular ganglion over here is called as your ciliary ganglion. Okay, so they are entering into your ciliary ganglion. Once they enter into the ciliary ganglion, this is how the picture is. So this is your ciliary ganglion. This is the parasympathetic fiber. Right, anyways, random color. This is your parasympathetic fibers which is relaying within the ciliary ganglion. Now from here the postganglionic fibers are arising. These postganglionic fibers, they come all the way like this, surrounding the eyeball, and supply two important muscles. So one muscle is called as your ciliaris muscle. Another muscle is called as your sphincter pupillae muscle. Sphincter pupillae muscle. Ciliaris and sphincter pupillae. See, the same thing is happening over here. It is dividing into two branches. One supplies to your ciliaris, another one is your sphincter pupillae muscle, the postganglionic fibers, and this ganglia is called as ciliary ganglia. Okay. So these are some of the important branches which you need to know regarding the oculomotor nerve. So thank you so much for watching my video. Goodbye.